All right, I'm going to go ahead and get started just so I can be cognizant of your time. This is a shorter, just like 15, 20 minutes conversation about Count the Kicks. And so I was asked to present on how to talk about the app and talk about the stillbirth prevention campaign, evidence-based campaign with your patients. And so I'm going to be doing two things at once, admitting people as they join, but this is also recorded and it will be sent out to anybody that couldn't make it. But feel free to ask questions as we go. And just in the chat box is totally fine, or raise your hand and I'll stop. I want to make this as conversationally as possible. My background is in public health. I've been with Count the Kicks for about 3 years, but I've been in public health for about 15 years. My passion is really maternal child health, and especially how it's centered around systems level change. So you'll hear me talk about that a little bit here when I'm like, this is how you could integrate it, or what ideas do you have? Here's what I'm thinking. How could you integrate this into your workflow? And so Count the Kicks, as we get going here, just so you're aware, if you're not, I would just love to know, just in the hi, how are
There's
you?
several people that are having trouble getting in, so can you hang on for just
Oh, sure. Yeah, we'll wait. Just need to click on the link and then I have to admit them, so I think that's part of it.
for some reason it's saying it's forbidden. Let me see.
The more you try it, then it starts working, because I got it to finally work on mine.
Okay.
And I think Anna just got hers in to work. Courtney's is not.
Yeah. While we wait, people in the chat, could you tell me, have you heard of Count the Kicks? Yes or no? Before today, I should say.
You get yours?
No, mine I keep clicking and it just keeps saying forbidden.
It took like 10 times and then it finally let me in.
Here, let me find the link again and put it in the chat that you can copy and paste to people and see if that helps again.
Oh, crap, it's kicking me out.
I'll put this in the chat that you can share the whole thing so if people want to call. So here comes a Brandy.
Here, I got it.
You're copying it.
I don't have it. Didn't show up in my chat.
Yeah, see if that works.
Yeah, but I'm just sending it to you too, Brandy.
Oh, no, I'm in.
Okay.
Yeah, but the link didn't show up in the chat.
Oh, it didn't?
It didn't in mine. Did it show up on the
Yeah.
main screen? Okay, yeah. I think maybe it just I hadn't been admitted yet. Which is weird. But...
Yeah, just let me know when you'd like me to start.
You can go ahead because it'll be recorded. So
Yeah, I'll send you the recording so you can send it out to everybody.
Perfect.
So, oh, here comes some people. And I'll just keep admitting them as they come into the meeting. So as I was saying, my name is Megan Ockett. I'm the program director with Healthy Birthday, which is the nonprofit organization that created Count the Kicks, which is an evidence-based stillbirth prevention campaign. I was asked to come on and speak for about 15-20 minutes about our evidence-based stillbirth prevention campaign, specifically our app and how to use it and how to talk about it with patients. So I love having these types of conversations. Feel free to ask questions as we go. I'm not going to go through the entire slide deck. I just wanted to like highlight some key slides, but I wanted to send the full slide deck out to you. So I'll send that out. You could share it, and then people can go back and review some of the research and evidence behind the campaign if that interests you. And so if you're not that familiar with, here comes some more. If you're not that familiar with Count the Kicks, it is an evidence-based stillbirth prevention public health campaign. It was founded in Iowa. Hi. Yeah, go ahead. It was founded in Iowa. That's where I'm based, but we're a national organization. So we have partners in about 20 states right now where we've launched Count the Kicks like we've done in Iowa to see the success, hopefully, that in like your state where we launched with the health department. In Iowa, where we were founded and began, we've had a 32% reduction in the number of stillbirths. And public health officials have said there really wasn't anything else going on that would have made such an impact on the stillbirth rate other than the inception of Count the Kicks. And we also have research coming out about that as well, where we've seen a 1% decrease in the stillbirth rate every 3 months since 2008 to 2018, which is when we launched in 2008. So what it is, it's an early warning system for expectant parents, where what you'll be doing and what you are doing, you're already talking about kick counting, but this is a way to have an easier conversation about stillbirth prevention. It's educating birthing people on the importance of tracking fetal movement. It should take 3 to 5 minutes when you're with them. We have a mobile app that's completely free that you can talk to them about, or they can use paper kick counting charts. And what's really great about it is it's all about empowerment, right? It's all about understanding what's normal for you and your baby in terms of movement, and then knowing when and how to speak up to your provider or to go into your provider. So it helps reduce anxiety and bond with baby. I won't go into all of that, but I know those are top questions. And it will be on the slide deck too, that you'll see that there's research around how this doesn't increase anxiety and how it helps bond with baby. So what we say is 1 in 3 at-risk babies can be saved with Count the Kicks, because that's what we're seeing happen in Iowa, where we've seen that 32% reduction. And that's what we want to see happen in Alabama. So just really quickly, I think, one misconception is the fact that stillbirth, people might think stillbirth, the loss of a baby after 20 weeks of pregnancy, is not that common, but it is really common. It's not something that just happened in our great-grandparents' age. This is happening. I'm sure you all have experienced this and seen it with your own patients. And in Alabama specifically, the stillbirth rate is extremely high. 8.85 stillbirths per every 1,000 live births. That's 1 out of 113 pregnancies. And so you can see here on this chart kind of where Alabama falls in comparison to Iowa and in comparison to the national rate. So what we would love to do is work with wonderful individuals like you who are talking about this day in and day out and listening to your patients to get that yellow bar, that orange bar, down to the Iowa bar, or even less than that. So that's our goal. That's what we do. And then the stillbirth disparities that exist, this is specific to Alabama, but it is important to note that Black women across the nation are 2 times, sometimes 3 times, depending on the state, more likely to experience a stillbirth over their white counterparts. So this is showing you Black and other. This is the data that I have from the health department, but this is substantially higher than the white rate too. So we want to make sure that we're addressing the inequities that exist, that we're listening to every single expectant parent, that we're looking at their needs and making sure that they feel comfortable talking to you and things like that. So I'm going to not talk through the research and evidence. This is all going to be in the slide deck, because what I really want to get to today is the app and how to have this conversation with your patients, because it really is a 3-minute conversation every time you see them in the 3rd trimester. So you want to start having this conversation, and this is, I'm preaching to the choir, I'm sure, around the 3rd trimester. So if they're high risk, you want to start a little bit earlier. And the reason we say around 26, 27, 28 weeks is because that's what research has also shown, where babies start to really get into that pattern that we can easily track, and we can determine that that movement pattern is easier to track. So as you're talking to patients, I think communication is really important, right? Clear is kind. So making sure that they know that even though it's called Count the Kicks, it's any of those movements, right? It's a roll, it's a kick, it's a jab, it's anything but a hiccup. We get asked that a lot by patients and parents. I'm sure you do too, because hiccups are involuntary, so they don't count towards the movement count. So this is just another way that kind of breaks down how to have this conversation with a patient. So you're going to start in the third trimester. You're going to say, what questions do you have? I'd like to talk to you about the importance of tracking your baby's movements. Let's spend a couple minutes on this. Think through back when you've always had to do like motivational interviewing questions. Let them know like you want to hear from them if they have a concern. And that goes for anything, right? Like bleeding, contractions, same with fetal movement. If they're concerned about it, we don't want them to wait. You're here for them. And that's what you really want to stress. I can't tell you how many times I've talked to parents who have said, the most important thing that I took away from my appointment was the nurse put her hand on my shoulder and said, I'm here for you. I want to make sure that you feel comfortable with me. Call us if you have any questions. Go in if you can't get a hold of us. And that's why you went into this work, right? To help others. So you're going to talk to them about doing this at the third trimester. You're going to talk about this app that I'm going to show you in a minute. You're going to say, there's this really cool tool. It's completely free. It comes in a lot of different languages. You could take out your own phone if you have it downloaded, which I would recommend that you do, or you can open the brochure and walk them through the brochure. You're going to stress to them, this is probably the most important takeaway, and this is what research shows, you need and you want them to do this daily around the same time every day. We don't want them to be counting on the app when they think that there's been a difference in movement. We don't want them to do it just as they randomly remember. We want people to do it daily because that's how they're going to understand what's normal, the average amount of time it takes their baby in this pregnancy to get to 10 movements. And then that way they'll be able to tell if that changes. And the app will help with that. And I'll show you in a second. Because after a few days, you're going to start to see that pattern trend. And then we want them to continue tracking daily, preferably around the same time. So pick a time when they know baby's most active. Maybe it's right before dinner and it's, 5:30, or maybe it's right when they're laying down to bed and it's 9:30 in bed. All the other kids are in bed. They can sit there and they can focus on baby. Or maybe they can only do it at 2:00 in the afternoon because of their work and, after school activities and things like that. Just make sure it's around the same time every day so they can start to understand what that pattern is for each baby. So this is the app, and I know this slide is pretty wordy, but one of the things I would love for you to do is actually go into your app store if you're able right now on your phone, whether it's you have an Android and it's your Google Play Store or your iPhone, and just search for Count the Kicks in the App Store and find the little yellow clock icon and download it. So that way, after we're done having this conversation, you can play around with it later and get to know more of the resources and tools that it has. But I'm going to highlight, while you're multitasking, I'm going to highlight some of the features and really how it works. So when you download the free app, there are no ads. There's one pop-up that usually happens after they kick about a daily message, and it's something we can control. It's like a trivia fact. So there's no ads. It's completely free. It's in 14 languages, soon to be 16 languages. We just added Portuguese and Hebrew, so that's getting released today or tomorrow potentially. And so how it works is when they're ready to start counting, they sit down, they're focused on baby, they're bonding with baby. Maybe they're including siblings to say, come on, let's read a book and count your brother's movements or something like that. They hit that big red button that says start counting, and then they get this screen with this footprint and this clock. And so when they have a movement that they want to start with, they tap that footprint every time they feel a movement during the session that they're focused on baby. When they do that, a timer starts, and they tap that footprint every time they feel a movement until they get to 10 movements. And once they get to 10 movements, the timer stops. And what they start to see then is that graph that you see there on the bigger image behind that foot image is a visual representation of how baby's been moving. So after a couple sessions, the app will show them automatically, here's your average amount of time, here's what your last session was. It should be pretty linear, you know, there might have a little hills, you know, here and there, but it should be for the most part pretty linear. It should be around the same time. So if I'm counting, and this is my baby, for example, and I see my baby takes around 15, 17 minutes to get to 10 movements, I'm counting around the same time every day. This is their pattern, this is their trend. And one day I'm counting and all of a sudden it took an hour and 40 minutes or an hour and 30 minutes. What happens is that graph changes, it spikes up, which is a visual cue to me as the mom to say, huh, that's not my baby's normal. My baby's normal has been around 15 minutes for the last 2 weeks around this time. I'm going to call my provider and see what they want me to do. And then together you would work through what are next steps, coming in, getting checked out, making sure baby's okay. So now you have a highly educated individual with data in their hands that says, this is my baby's normal, or this is not my baby's normal. I know when to speak up and when to come in. And so one of the features that they can do with this is they can set a daily reminder. Remember how I stressed that earlier? They can do that within the app. So they don't have to go out to their own calendar. So as you're talking about this with your moms or patients, especially for the first time, you can say, let's go through a session together, because you can always go and delete that. Let's go through a session together, and then let's set up daily reminders. When do you think baby's most active? Has it always been like you feel like you can really concentrate on those movements before dinner? Like, let's set those daily reminders up together. And then next time I see you, I want to see your data. I want you to show me how it's been going, because you'll be counting daily. They can also download their data and send it to you directly. They can print it out. They can share it with significant others. The app is available to count for single babies or twins. You can track future pregnancies. You can manage multiple devices. So they could count on the iPad one day and then their iPhone the next day and their watch the third day. It doesn't matter. It all syncs together. We will be releasing a web-based kick counter. So if you have individuals who maybe just prefer a PC, or maybe they're at work and it's 2 o'clock in the afternoon and they can't pull out their phone, they could just count on the web. So that will be coming out. So sign up for our newsletter just to make sure that you get wind of when that happens. That will be in the next couple of weeks, probably after Thanksgiving is when that will be released. So those are some of the key features that I wanted to highlight. The other feature that I wanted to mention was the strength tracking feature. And so what we added this last year, because what we were finding was research and providers telling us that not only should we be tracking movement, but also the strength of those movements. And so what we did is we worked with researchers and providers to create a way to do that on the app. And so when you're counting and you're tapping that footprint, after you get to 10 movements, what happens next is that second screen pops up and it says almost done. Please fill out the following fields to finalize your kick session. And then they have the option to learn, like click on the I for information. Basically, what we want them to do is rate the strength of that entire session. How were baby's movements strength-wise during that session? Were they strong? Were they fierce? Could you really see movements coming out, or were they light and fluttery like you might feel like at 20, 21 weeks when you first start feeling those movements? The most important thing here is that the strength, again, really doesn't decrease, right? Like that's what we want to pay attention to. So again, they get a bar graph this time for strength, so they can visually see this baby here has had pretty, 3, 4, 5. And then if you look at the very last movement strength, you can see the top graph is the movement where it says that's the line graph, and then the bar graph is the strength. So for this example, this baby obviously took quite a bit longer. You can tell because the graph shot up and my movement decreased. I'm not saying that these have to connect or coincide together. I'm just saying that the app is very visual, so you can see. So whether your movement time is the same, but your strength decreased dramatically, and you see that representative, encourage your patients to call you. That's why you're there. No matter what time, no matter what day, that's what they want. What number do they call if it's after hours? What if they can't get a hold of anybody? We don't want them to leave a message, right? We want them to talk to somebody, have them go into labor and delivery triage. I went 3 times with my daughter. Didn't understand that 30 minutes was her movement time. That was her normal. That seemed like a long time compared to my previous pregnancy, where I would get 10 movements in 5 minutes or less. So I shouldn't have been comparing, right? I just didn't understand that that was her normal. And then the other feature that I wanted to highlight on the app was this Healthy Birthday Find Help resource. So in the resources section of the app and on our website, actually, people can access free or reduced cost resources by entering their zip code. So this is a great tool and resource to just share with your patients, to say, like, maybe they want to find diaper banks or housing assistance or childcare assistance. They're all free or reduced cost services. So they can just enter their zip code. This is an example for where I live. And then I can search, even filter it from there to find additional programs that I might need. And so I wanted to share just really like how this app works in real time. So let's watch this video. And this video is something that you could share with your patients. It's on the app in that video section, or we have clinics that are rotating through videos in their waiting room. So be thinking through how you can integrate this. The more touch points, the better. It's you talking about it. It's having it in a poster in the patient room, and then in the restroom when they give the urine sample. Libraries order this. So there's a lot of different ways that you can incorporate this and make sure your patients are aware of it every single time they visit you.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
So that's something that you could share with your patients. Super easy. You could put it in the way. We have a lot of videos that you could put just rotating through on your waiting room. Just really briefly too, talking about stillbirth. I think that, I'm not a provider, but I was never talked. I've had 3 living children. I was never talked to about stillbirth, and but I was talked to about the concern of listeria, right? And that's really not that common. I was so scared to eat cold meat or even ice cream in, the like McDonald's because of soft serve and listeria. I remember calling my provider. So why don't we talk about stillbirth, just like we're talking about all these other things that could happen, right? I think we have this as a society idea that it's taboo, it's dark, it's sad, we get that, but we talk to expectant parents about so many things. And this is something that we should talk to them about and that we have to start talking about. Otherwise, we're going to continue to lose 23,000 babies every year. That's 65 babies a day in the United States that are stillborn. That is a busload of kindergartners. That is unacceptable. Stillbirth just happens. There's nothing we can do. We know that a change in baby's movement is one of the first and sometimes only warning signs that baby gives when baby's in distress. Or I've heard this one, my baby's always active. You might hear this from your own patients, like when you're talking about it, like, oh, it's like a jungle gym in there. I don't need to do this. Or as a provider, don't worry about it. A healthy baby is an active baby. And that's true. A healthy baby is an active baby, but it's still really important to count those movements so we understand and know if our normally active baby has slowed down. It takes the guesswork out of knowing that. They're almost at our due date. I'm sure everybody knows this, but actually the risk of stillbirth increases dramatically after their due date. I could find some research on it. I was just at a conference, but I mean, it is after 40, 41 weeks, 42 weeks, the stillbirth rate jumps way up. And then if you're talking to expectant parents who have previously had a stillbirth, you'd follow the same protocol. You're going to read the chart prior if you weren't their provider before, or if you were their provider. Even if you weren't, ask them about their previous stillbirth, ask them what was the gender, what was the name, staying away from, again, preaching to the choir, staying away from medical terms. Like I wouldn't say fetal demise. And these are just things that we've heard from talking to lost moms, and then asking them, has anybody ever talked to you about the importance of counting your baby's movements? Like what's their history like? Because, we've talked to a lot of individuals who have had stillbirths and then had previous live births, rainbow babies, and they've said, nobody, not once had somebody said, you should be tracking your baby's movements. I noticed a change in my baby's movements, but I didn't know I should have spoke up. Why didn't I know? Why didn't somebody tell me this? So we want to turn that why didn't I know into, I'm so glad my provider spent 3 minutes with me talking about this. I'm so glad I took the glucose test and then they had me download the app while I was waiting there in the clinic. I'm so glad I saw it in my waiting room. There's just so many opportunities. So these are just some other common myths I won't go over, but these will all be on the slide deck. I think one that I get asked a lot was, I will stop here, this 10 and 2, right? 10 and 1, you should get 10 kicks in 2 hours. You should get 10 kicks in 1 hour. There's actually research on this, and we have it on our website too, and I can share if you're interested in it. And what the research shows and what we're really starting to see is it's really important to become aware of what's normal for your baby in general, and not focusing so much on the hours, because what happens then, and this is what this research study showed, was as human beings, that's what we focus on. So I had you for 20, 25 minutes, probably supposed to be 15 minutes, but I'm focused on the time, right? So when we tell somebody 10 and 2, what can happen then is if I've been tracking and I know my baby for the last 3 weeks has taken 15, 20 minutes, and then one day I'm tracking and all of a sudden it takes 1 hour and 40 minutes, I think to myself, well, that's okay because I still got 10 movements within 2 hours. But that's not my baby's normal, right? My baby's normal has been 15 or 20 minutes for the last 3 weeks. And now it's 1 hour and 40 minutes. I'm going to contact my provider and see what they want me to do. 9 times out of 10, everything's a-okay. We want to make sure we catch that one time that maybe something's off. Maybe it's, fetal growth restrictions are caught earlier. It's not an automatic C-section. I think that's another misconception, that this increases C-section rates, and it doesn't. Our C-section rate in Iowa has not increased. Research has proven that this does not increase C-section rates. There's also a connection between stillbirth and maternal mortality. So you're 4 times more likely to die if you have a stillbirth. So if we can prevent stillbirths, preventable stillbirths, do we have the opportunity to also prevent maternal mortality from happening? So these are some other common myths. Here's another one I'll spend just a moment on about, I can't get baby to move. They're not moving like normal. Drink a Mountain Dew, eat a Snickers bar. I've heard jump up and down. And again, research shows kick counts are best monitored without interventions like that, because if baby's not feeling well, whether it's an infection, they can't move because of an umbilical cord, why are we trying to force baby to move? It's just like when you and I are sick. When we're sick, we're on the couch, we're resting, we're conserving our energy. Same with baby in utero. If something's going on, then we want to make sure that we get baby checked out with the NST, the biophysical, all the other steps that you as clinicians know that you should be taking. So those are those pieces. And then I also wanted to talk through just really quickly other ways you can integrate this. If any of you are labor and delivery, this is a great time to have Count the Kicks information. We have gold standard that I'll show you on the next page here, where, like I said, I went 3 times with my daughter. How great would it have been if they printed my discharge papers and there was a whole section on fetal movement monitoring, right? So you could easily add that in. We have other hospital systems that are doing that. I can show you how to do that. I can work with you afterwards. Make sure your front desk staff's trained. I'm assuming that nobody really gets to a voicemail, that they're always talking to a nurse if they call. But if not, and the front desk staff asks, somebody asks them a question, make sure that they know they need to get that question, if it's around fetal movement monitoring or baby's not moving like normal, directly to the nurse or the provider. Glucose test I mentioned. When I always had to do my glucose test, I had to go and drink it in front of somebody, and they watched me, and then I had to sit there at the clinic for 1 hour for my blood test. What a great opportunity. That's right at the 3rd trimester to say, drink this awesome liquid, sit here, read this brochure, download the app, and when you come back, let's talk about it. EMR, EHR, could you put a note where it notifies you they're in their 3rd trimester, talk to them about Count the Kicks? Could you add a simple recording This is our gold standard after visit summary discharge paperwork that I'd be happy to send to you. What's also great is in Alabama, you have access to all this free material. You can get our promo poster, our how-to poster, you can get brochures, you can get picture-based materials. So if you are in an area where you work with a lot of, refugees or where English is not their first language, you can use the picture-based materials. All of these materials in Alabama are completely free. You can scan this QR code, order the materials. They should go in waiting rooms. They should go in patient rooms. They should go in restrooms. They should go in if you have those like newly pregnant kits or binders that go out, they should sit at checkout, the brochures, the app reminder cards. We have magnets that you can hand to moms and expectant parents. So make sure you're utilizing these free resources. We have an online CE training. I will send this so you guys don't have to like write this down, but I'll send this in an email and it can be sent out to you. 2.2 CEs goes into a lot more detail than I am today. And that's kind of what I have for you today. I'd be happy to answer any questions, or I really thank you for your time. I know this is a busy time and it's the lunch hour, so I appreciate that, but I'm happy to stay on and answer any questions or go into more detail of anything that you'd like me to, but I do appreciate all your time today. And thank you for all that you do to make sure that patients have the joyous birth experience that they deserve, because that's what we all want, right? Healthy mamas and healthy babies. So I appreciate that. And if no questions, you're free to go, I think, unless you had like other things to talk about.
No, thank you so much for coming on and talking to us. This helped a lot.
Good. I'm sure you're already doing this to an extent anyways. I think it's just nice to have the tools and resources to have that conversation, because it is a hard conversation, right? Like nobody wants to talk about it, but we can make it easier, and it's empowering, I think, to say like, this is something you can do. You can track your baby's movements, bond with baby, focus on baby. I think it's great. So I'll send this out to you so you can forward it on to everybody. So yeah, and I'll send you the recording as well.
Perfect.
Awesome. Thanks, everybody.
Thank you.
Thank you.
Have a good afternoon.
You too.
Thank you. Bye.
Bye-bye.
Thank you.